Have you ever been confused about cholesterol tests? LDL, Lp(a), ApoB, HDL to triglyceride ratio? Let me explain the helpful ones and the not helpful ones in a single post. Hi, I'm Derek. I'm a preventive cardiologist, and here's the good, the bad, and the ugly of cholesterol tests. First, the useful ones. Fasting lipid panel. That gives you your main cholesterol particles, your total cholesterol, your LDL, HDL, non-HDL, and triglyceride. This is the main basic cholesterol test. With this, LDL is one, it directly builds up plaque. It's considered the main bad cholesterol. This one is also the target of a lot of misinformation on social media. Trust me, anyone spreading misinformation about LDL and that it's not bad for you, that person has never scrubbed into a heart cath. But it's not the only important one. HDL, the good cholesterol, I call the benign cholesterol. It's kind of fine if it's a normal level, but non-HDL is important. That's all the not HDL, so like the LDL, IDL, VLDL. It's a better measure than LDL, but it doesn't tell the full story. ApoB is the gold standard. It measures all the ApoB carrying particles, which are all the bad particles that build up plaque. If you only get one test, make it ApoB. Then Lp(a), it's the number one inherited cause of heart attack, basically a sticky or worse form of LDL cholesterol. If LDL is an alligator, it's a crocodile, a scarier version. Then we have triglyceride, back on that first lipid panel test. It's like the diesel to cholesterol's gasoline. It's similar but different, but it also builds up plaque and it's related to insulin resistance and metabolic syndrome. Okay, so fasting lipid panel, ApoB, and Lp(a). Those are the main best tests. There are some other ones like ApoA, which is related to HDL cholesterol. That's fine, but I don't use it. There's also the total to HDL cholesterol. That ratio has been replaced by ApoB. Now for the tests that aren't helpful. LDL particle size. Lots of tiny particles, a few big fluffy particles, either can build up plaque. It doesn't add information that will change your plan or your outcome. Triglyceride to HDL ratio. That is useful for telling you that the person you're working with doesn't know what they're talking about. It's not helpful. VLDL cholesterol. This one's kind of like me in high school. It's like technically there, but it's not really making an impact. It doesn't give value beyond ApoB. Then basically any ratio is not really helpful. That's someone kind of making up a reason to nullify an important harmful factor other than ApoB to ApoA. That's one helpful ratio, but I don't use it in my practice. So there you have it. Fasting lipid panel for your total LDL, non-HDL, HDL, and triglyceride. ApoB, the best test. Then Lp(a), one of the most important and most overlooked. Those are the three main ones that I use in my practice. Check those, control those, and you've controlled your cholesterol risk. Please share this with someone that should get these checked, and if you have any questions, I'll meet you in the comments.